Wow. New question from Christy. My dad had his surgery to remove his esophagus and larynx in early November. This week we found that he has no evidence of disease. Thank you, Lord. The surgeon wants to do chemo, but his other doctors think he cannot handle it. Did anyone help have chemo for maintenance after surgery?
Right. So, if I recall, did this user is calling in from another country? Is this the one that is calling in from Japan? I can't remember.
I don't. Oh man,
So,
it looks like there's one other
okay.
question.
So, yeah. So generally speaking, if patient undergoes chemo and radiation before surgery, then after surgery, the treatment is only immunotherapy, unless there is metastatic disease, unless there's spread of disease. If, however, the patient got surgery up front without chemo and radiation, then they from that the disease was higher than a T2. So it was either T3 or there are some lymph nodes. Then you have to do some therapy afterwards. And that therapy can be radiation and chemo, or it can be just chemotherapy. There are various regimens. So it depends on the specifics of the case. Did this patient get radiation up front, chemo and radiation? Did they mention?
I don't. They didn't mention. However, there was a follow-up. Okay. Let me just read the follow-up out loud.